Hello everyone. Today we are going to talk about Lab 2, which is the Cardiovascular Physical Lab Assessment. So, we'll start our today's presentation by knowing that why we want to know about heart sounds and what exactly we should know about heart sounds. We listen to heart sounds using a stethoscope, and we will talk about stethoscope in a bit. The main focus for today's first half of the discussion is to identify the landmarks associated with four valves, which are aortic, pulmonary, tricuspid, and mitral. Then we will talk briefly about normal and abnormal heart sounds. We've come to our second half of the presentation, which is about the basics examination of peripheral pulses, and we will again talk about the landmarks associated with four pulses, which are carotid, radial, brachial, and dorsalis pedis, and then we will discuss very briefly about the data sheet which you need to fill at the end. The points which are highlighted in red are the objectives of this practical, and you should know the landmarks associated with the four valves and four peripheral pulses. So it's time to make a start, and we will talk about heart sounds first, which is the first half of our practical. So the question remains that what and why should I learn about heart sounds? We need to know about heart sounds. I'll talk about it later, but first I will let you know that you should be able to identify landmarks associated with the heart sounds so that you should know about heart valves, and you should be able to auscultate or listen to the four heart valves, which are the pulmonic or the pulmonary, aortic, tricuspid, and bicuspid valves. Now, knowing these four valves, now let's see what are the advantages. Once you are able to auscultate these heart sounds normally, this will help you to differentiate between the abnormal heart sounds which occur once our heart valves are not working properly and they are associated with any kind of pathologies, whether it is the regurgitation or it is a blockade or a stenosis. So how are we going to listen to those heart sounds? That is why we have to talk about the instrument which is used by the health professionals all around the world all the time, which is the stethoscope. This is a diagram of the stethoscope, and I'll just talk briefly about it. It was discovered by Lubbock, and the purpose of this instrument or stethoscope is to auscultate, or the act of listening, or you're going to hear or listen to different kind of sounds inside a body through this. Now, how this is going to work? We will first talk about how we are going to wear it. So this part is known as the ear tip. It is also known as the earpiece, or the part which is put into the ear. And the important part is that once you hold the stethoscope like this part should go downwards and medial. And the reason for putting this downwards and medially is because the direction of our external auditory canal is downward and medial. So if you put stethoscope in this direction, the sounds will directly go through that canal and hit the eardrum, and you will listen really good. Now, this is connected via metallic tube to a rubber tube, and this rubber tube is connected to this part, which is known as the chest piece. Now, the chest piece is made up of two parts. You can see the small part, which is known as the bell, and this big part which is known as the diaphragm. So if you just summarize the parts of the stethoscope, it has a headset which contains the earpiece and these metallic tubes connected to this chest piece via this black rubber tube, and then the chest piece has two parts, the diaphragm and the bell, and we'll talk about it very quickly. As far as holding the stethoscope is concerned, you want to hold it between the index finger and the middle finger so that you can move it smoothly over the surface of the skin for whatever purpose you are using the stethoscope. Now, we can use stethoscope for a lot of things, but I want to highlight a few basic important functions of the stethoscope. We can measure blood pressure or BP, which we'll do in our next lab. We can listen and assess heart sounds, which we are doing in our practical today. We can also put it on the different parts of the chest over different lung fields to listen to different lung sounds. We can also auscultate and assess by putting it on the abdomen to listen to bowel sounds. Now, we want to differentiate between the diaphragm and the bell. As you can see here, this part is the bell, which is the smaller part. Because it is small, it will help us to listen to heart sounds or sounds of low frequency. But if you see the bigger part, which is the diaphragm, it is used mostly for high frequency sounds, and we are using diaphragm to listen to all the heart sounds in our lab. So for you, diaphragm is more important. These are a lot of characteristics which you can listen using a stethoscope. You can listen to the rate, rhythm, duration, frequency, murmurs, which are the abnormal heart sounds, and you can also appreciate the quality of sounds using a stethoscope. Now, we know which instrument we are going to use to auscultate the heart. Now, the part which is coming up is the most important part, which is going to be tested in your practicum. So pay a lot of attention, and I want to go over it in real detail. This is the diagram of the chest with the ribs shown in the background. We are going to listen to 4 heart sounds, and I'm going to discuss each one of them and the associated landmarks. Before we talk about the landmarks, I would just want to talk very briefly how to identify these landmarks on the surface of the skin. So if you look at the skeletal part of the thorax, it shows that this part is known as the manubrium sternum. You can see here, if you just palpate this depression here, this is the manubrium sternum. If you go down from here, you will see a protuberance, which is the junction of manubrium sternum with the body of sternum. There is a protuberance or a prominence here. And the important point here that at this juncture, this second rib is going to attach, and below the second rib, you have the second intercostal space. So this is how you identify the milestones on the bare chest of the patient. This is the manubrium sternum. Go down, this is the protuberance where the second rib attaches, and below this is the second intercostal space. Now, why am I talking about these milestones? Because you are going to auscultate these heart sounds depending upon these milestones. So the first 2 valves which I want to talk about are the aortic and the pulmonic. And we will talk about this set first because both of them lie on the second intercostal space which I just talked about. So aortic is there in the second intercostal space, pulmonic again there in the second intercostal space, but the point to remember here is that aortic is the only one which is there on the right side. You can see this orange circle, so that's the only one which is there on the right side. else everything is on the left side. So we start with A, the aortic, right side, second intercostal space. Second one, just opposite to it, pulmonic or pulmonary, second intercostal space again, but it's on the left sternal border. So we'll talk about the aortic and pulmonic first in the second intercostal space. If we go to the third and fourth, this is associated with the fifth intercostal space. So you can see that in the fifth intercostal space, this is there on the left sternal border. So on the left sternal border, you have the tricuspid valve, and on the other side, you have the bicuspid valve, which is there on the midclavicular line. Now the question is that how you're going to identify the midclavicular line. So this is the clavicle. If you go through the middle of clavicle, go down, identify the fifth intercostal space using the same old principle which I've just talked about. So this is the first intercostal space, second, third, fourth, and fifth. And in the fifth one, if you move to the midclavicular line, you will find the bicuspid or the mitral valve. So if I want to summarize this whole story once more, you will find second intercostal space, right side, the aortic valve. On the opposite side, you have the left sternal border, second intercostal space, pulmonic. In the fifth intercostal space, on the left sternal border, you have the tricuspid valve, and on the midclavicular line, you will have the mitral valve. So these are the four landmarks associated with the four heart sounds and heart valves. All right, now we will talk about the normal heart sounds. The first heart sound is known as the S1 or the lub. Now, we will talk about how this heart sound occurs, which physiological event is associated with it, what is its characteristic, and how does it sound. So these are the 4 points under which we are going to discuss both the heart sounds. If we talk about the first heart sound, we just try to think about the fifth intercostal space we have just talked. In the fifth intercostal space, we have the tricuspid and the bicuspid. So both these valves close simultaneously, and you will listen to the first heart sound. And this is the point when the ventricular systole begins. This heart sound is loud and long, and it sounds as lub. You can try to remember as that if it's lub, it is loud and long, and it is due to the closure of the tricuspid, the bicuspid valve. If we look at the second heart sound, that is known as dub. You can see in the diagram here, and this is all about the second intercostal space, the aortic and the pulmonic. So both these valves close simultaneously to produce or create the second heart sound. And this is associated with the ventricular diastole, which is another event of the cardiac cycle. Now, this is in contrast to the first heart sound. It's soft, but it's sharp. And this is again sounds as dub. Another important point which I haven't written, but I want to mention is that only the closure of the valves produce heart sounds. Never ever an opening of the valve produces heart sound, because once the cusp of the valve close like this, they produce vibrations, the extracellular fluid, which are transmitted onto the skin, and you listen to the heart sounds. Right. Now, knowing about the normal heart sounds, now we will talk about names of a few abnormal heart sounds. So the first one is the murmurs, which are the abnormal heart sounds when the valves are not closing properly. Either they are stenosed or blocked, or they just become very loose, so they have backflow of blood, which is known as regurgitation. So in these conditions, you will listen to abnormal heart sounds, which are known as murmurs. Apart from S1 and S2, which are the normal heart sounds, we have abnormal heart sounds, which are S3 and S4, and you can have something which is known as pericardial rub. So whenever the layer of the pericardium rubs against each other, that is between the parietal and the distal pericardium, then we have the pericardial rub. It sometimes happens in pericarditis when the fluid in the pericardium dries out, and you can listen to pericardial rub. Now, I guess we are done with the first part of our practical, that is the heart sounds. You just want to remember the four areas: aortic, pulmonic, tricuspid, and bicuspid. Aortic, pulmonic, second intercostal space; tricuspid and bicuspid, fifth intercostal space. And you want to know something, you have learned actually something about the abnormal heart sounds and the normal heart sounds, the S1 and the S2 before. Now, it's time to get going for the second part of the practical, which is the peripheral pulses. Now, if we look at the basis of examination of peripheral pulses, we have the definition of the pulse. What is pulse or a pulse wave? The first thing I want to highlight in this definition is we are measuring or palpating or feeling artery here. And because these arteries are present on the periphery, that is why they are known as peripheral pulses. You can have veins as well, but we cannot palpate veins because of less pressure. So the idea is that whatever things we are trying to palpate, it is a pressure wave in the artery which are peripheral. So if you look at the classical definition, it says that a pulse is a pressure wave which is caused by the momentary stretching, relaxation of arteries with each heartbeat. And now I just want to talk very briefly about its physiology, that how does this pressure wave is produced. So once the ventricles of the heart contract, then the blood is pumped out of the aorta, and from the aorta it goes to all parts of the peripheral body, and this pressure wave moves from the heart, moves to the periphery, and we palpate that pressure wave as pulse. This is just a diagram to evaluate, but I want to tell you and try to show you the technique to palpate the pulse. So you can use either 2 fingers as shown in the diagram. Sometimes you can also use 3 fingers, and you try to use the distal phalanx or the pulp of distal phalanx to palpate, and with the other 1 or 2 finger you can stabilize the artery so that it won't move. So first try to locate the artery, stabilize it, and then use the pulp of the middle finger, the distal phalanx of the middle finger, to palpate the pulse. So this is the right technique, and we can learn more about it in the lab. Now, once you are trying to examine the pulse, what are the points you want to look at? There are a number of things which I have written, but we are bothered about the basic 2, which are the rate and rhythm. Although you can have information about the volume of the pulse, the character of the pulse, and you can palpate 2 pulses on the 2 sides of the body simultaneously to know whether they are synchronous or asynchronous. But rate is and rhythm are extremely important for you guys to know and record. So the normal rate is between 60 to 100 beats per minute. So if once you guys are palpating amongst each other, the rate should be between 60 and 100. If it's more than 100, this is called as tachycardia, and if it's less than 60, This is known as bradycardia. There are a number of conditions associated with tachycardia. For example, physiologically, if you're doing an exercise or if you're excited, you can have increased heartbeat, which is tachycardia. If you have any pathological condition, for example, if you have an infection or if you have fever, you have increased heartbeat again more than 100 beats is tachycardia. As far as bradycardia is concerned, once you sleep or at night, your pulse rate may decline, sometimes less than 60, which is a physiological bradycardia. And there are a lot of other conditions, pathologically, for example, hypothyroidism, where you can have decreased pulse rate or bradycardia. Now, the pulse should have a normal rhythm, or to be specific, a regular rhythm. Regular rhythm means that once you are palpating the pulse, it should strike your palm of the finger at equal distance. For example, the spacing between each of the hitting time should be the same. It means that the rhythm is irregular. If it's striking quickly, then again there is a huge gap, and then again it's striking quickly. It means that the rhythm is not regular, it is irregular. Irregular rhythms can either be regularly irregular if it's occurring at the same time, or if it's totally haphazard, which can happen in fibrillations or flutters, it is irregularly irregular. Now, these are some of the locations where we can palpate the peripheral pulses, and the things which are highlighted in red are the places where we are going to do it in our lab. So you can palpate to the carotid in the neck, the brachial and the radial in the arm or the upper limb. We can also palpate the ulnar, which we are not going to do, the femoral and the popliteal in the leg, and on the foot, it's the posterior tibial and the dorsalis pedis, but we are only concerned about dorsalis pedis. Now, again, as I've talked about the head sounds, this is the slide to look for, because this is the one which you're going to do it in the practical, as it says that the landmarks associated with palpating pulses in carotid, brachial, radial, and dorsalis pedis arteries, and we are going to discuss each of these in whatever detail is possible. Let's start with carotid. This is the artery of our neck. In order to identify, you just have to identify two landmarks. This part is known as the larynx or the Adam's apple, and this prominent muscle in your neck, this one, is the sternocleidomastoid. So these two forms the anterior triangle of the neck, and you can use two fingers to insinuate beneath this sternocleidomastoid to find about the carotid pulse. Big caution, two cautions actually. Never try to use your thumb to palpate an artery, because the thumb has its own pulse, so you might not be able to differentiate between the pulse of the thumb or the artery. So always try to use the fingers. Second one, this artery is supplying the head and the brain. So never try to occlude both the arteries. The patient can land into syncope, he may pass out. So always try on one side, never try on two sides. Okay, let's try to find the brachial. So in order to find the brachial, just try to find the tendon of the biceps brachii muscle. So you put the hands on the arm, ask the patient to flex the arm. You can see a tendon here. This is the tendon of biceps brachii, and if you move medial to this tendon in the antecubital fossa, you will be able to palpate the brachial artery. So this is the classical location of brachial artery. For the radial, you have to be very, very smart, because this is the artery which you're going to palpate throughout your professional careers as in kinesiology. So the first thing is, it should be there on the side of the radius bone, as the name suggests. So you try to go on the lateral side of the forearm and try to find this prominence on the radial bone, which is the radial styloid process. And then you try to use the 2 or the 3 fingers and try to push this artery towards the radial styloid process. And again, using the pulp of the distal phalanx of the middle finger, try to palpate by stabilizing the artery with the other 2 fingers. So this is about radial artery near the hand. And the last one is the dorsalis pedis in the foot. In order to palpate this artery, you first want to identify this area, and the best way to do this is to look at the first interdigital cleft. So this is the thumb, the great toe, and this one is the first phalanx of the foot. So if you go go through the cleft between these two and just move above, you will find that a tendon, which is the tendon of extensor hallucis longus. And if you move lateral to this tendon, you will somewhere feel the dorsalis pedis pulse, and you can search just a big distal and proximal here and there to find this artery. It is a bit feeble as compared to the other 2 arteries which we have been palpating, but it's too peripheral and you can always get it. Okay, so before moving on, let's summarize these 4. You have carotid in the neck in the anterior triangle. You have brachial in the forearm, in the antecubital fossa, just medial to the tendon of the biceps brachii. You have radial just near the hand. Try to identify the radial styloid process as the milestone. And in the foot, just try to identify the tendon of extensor hallucis longus in the first interdigital cleft and move lateral to the tendon to identify this artery. Now, why we are palpating the pulse? This is a good question which we have also talked about in the heart sounds. So resting pulse is a good indicator of the function of the heart. It tells us about a lot of other things as well. And that is why it's a part of all the systems review of the patients once they go to the doctor for the first time, whether it's the examination of the cardiovascular system, the respiratory system, or the abdominal system, musculoskeletal system. They just want to know the function of the heart, and they just listen. They just palpate your radial artery. If you're doing exercise, a lot of other activities, then also heart rate plays an important role. And in cases of a lot of emergency situations, for example, if it's an RT or a road traffic accident, in cases of pathological shock, when this pulse becomes really feeble, difficult to identify because of a loss of blood, heart pumping less blood, the pressure is not big enough to reach the peripheral arteries. So there are a lot of other abnormal pathological conditions where palpation of peripheral arteries are important. In cases of peripheral vascular diseases, the Burgess disease, etc., it's also important to know the vascularization of different parts of the body. Now, how do you assess pulse? There are different scales. You are not expected to know these scales for your practicum, but it's just a good idea for your overall knowledge to have an idea that if you can find the pulse is 0, if it's reduced, it can be either it can be either 1 or 2, which is very normal in case of shock. If it's 3 in the above scale, and if it's 2 in the scale from 0 to 3, it is normal. And if you have some higher circulatory or higher output cardiac conditions, then you have bounding pulse, which is very common physiologically in case when somebody is exercising, when the cardiac output is increased from 5 liters to, let's say, 6 or 7 liters, or in cases of anemia, high volume or full bounding pulse is seen. Now, this is the end of our presentation. I just want to summarize what we have talked so far, why heart sounds are important, we talked about it, and why you need to know to identify murmurs and abnormal heart sounds. We talked about the stethoscope, its parts, and then we have talked how to place the stet, different parts of the stet, how they are used to auscultate to low and high frequency sounds. Then we talked about the four big heart valves, the aortic and the pulmonic in the second intercostal space, tricuspid and the bicuspid or the mitral in the fifth intercostal space. We talked a bit about different abnormal heart sounds and talked about S1 and S2, which is the closure of tricuspid, bicuspid, and aortic and pulmonic, respectively. Then we talked about how to palpate peripheral pulses, and I showed you how to palpate the carotid, the brachial, the radial, and the dorsalis pedis pulse in the foot. And now I will just walk you through to the datasheet 4, which you are going to do in your practicals. This is a document which I want you to read in your PowerPoint, because these are some of the points which are expected for you to perform in the practicum. And this is the data sheet. So here you're going to fill your basic details, and then once with your partner, once you are listening to the aortic, pulmonic, tricuspid, and bicuspid heart valves, I want you to write the sounds. For example, if you are listening to the aortic valve, then whether lub is more loud or dub is more loud. And if you listen to both lub and dub, you can write these sounds in all these places. For example, you can write lub, 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 dub, dub, and then you can also write that out of these, which one is more prominent. You are going to do the same with the pulmonic, tricuspid, and bicuspid, and write the apical heart rate by using the stet, put it on the mitral valve, and count the heart rate by listening to it. The second one is about the peripheral pulses. So you have the radial, the right and left, the brachial right and left, the carotid right and left, and dorsalis pedis. So you are going to write whether the pulse, are you able to palpate it or not, whether you find its strength strong or weak, whether it's regular or irregular, or what is the rate. So for all pulses, whether it's the radial, the brachial, the carotid, or the dorsalis pedis in the foot, you have to write about these 4 points. We can talk about these data sheets a lot in the practical once you're doing it on your partner. And please let me know if you have any questions. This is a YouTube link where you can revise and recapitulate how to palpate the peripheral pulses and how to auscultate the heart sounds. And please let me know if you have any questions. That's the end of the presentation. I hope you're able to follow some parts of it for sure. And I'm happy to answer all of your questions once we meet in the lab. Great. Thank you very much.